How common are food allergies? About 5% of infants and children develop them, often to cow's milk, soy, wheat. But hopefully, parents hope that they will outgrow these by the time they're 5. It may be that their gut or their stomach, intestinal tracts are not yet mature. So when they mature, they stop being allergic, or it may be a change in the immune response. I think you can tell we're not really sure right now. Food allergies are rising. Is it because we have an increased awareness or an increase in reporting? I don't think so. One theory is the hygiene hypothesis, that with less exposure to dirt and germs, the immune system is weaker. It's a concern that we are too clean. Another theory, could it be changes in the way food is manufactured? So, for example, with peanuts, the boiling versus the roasting can affect the protein on the surface of the peanut, and with the changes in the way the food's processed, there may be more proteins on the surface, leading to increased allergic reactions. Maybe a lack of nutrients, vitamin D, vitamin A B vitamin called folate or folic acid, or delayed food introduction. One example of where this has been shown to be true is with peanut allergies. We used to recommend folks wait till after children were 2 or 3 before they started introducing peanuts. But now we know that early introduction of peanut products, particularly one called BOGUS, and I'll show you the bag in a few minutes, is associated with reduced risk of peanut allergies. How do you diagnose a food allergy? There's a skin prick test where you inject the allergen, maybe you've had them on your skin, and you look for what's called the IgE, immunoglobulin E response. There are other blood tests that are more specific, but these are the skin prick tests. A negative result means you're not allergic to food. A positive result's not always accurate, so there are false positives. The oral food challenge is probably the most accurate, where you give somebody that food, you orally challenge them with that allergen, but you want to do it under doctor supervision, because if the person has an allergic response, you want to be able to treat them right then and there. Now, be wary of bogus tests. There are companies that will test you, just spit into this or send some body product to this company. It's unreliable. What they are testing for is IgG. Remember, there are 2 immunoglobulins I'd like you to remember. IgE is for allergies. IgG simply means you've been exposed, that you've been in the presence of this. Other unreliable tests, hair analysis. You can't analyze food allergies or pretty much any other allergy with your hair. Certain types of blood tests, looking in the eyes, those are bogus. You want to have the skin prick test. You want to have it in an allergy doctor's office. Treating food allergies. There are no allergy shots yet available for food allergens, with the exception of peanuts. You're injecting peptides or tiny pieces of protein, only ever done in a medical setting in case there is a response. Once the allergy is confirmed, the only treatment is to eliminate that food from the diet. The exception, again, happens to be peanuts. In January of 2020, there was a powder that was approved by the FDA for treating peanut allergies. It's only approved for a certain age group. It involves a series of visits where you give a tiny amount of this powder, increase it again in the medical professionals in case there is a reaction. The picture I have here, which I should probably have on another slide, is a product called Bombas. These are like cheese doodles, but they're peanut flavored, and they have peanut in them, and that is what you can give to a small child. It kind of melts in their mouth. These seem to be something that small children can have without worry of choking. It may be what that early introduction is reducing the risk for peanut allergies. Now we're going to look at food intolerances. If we compare side by side allergies to intolerances, they are 2 different things. A food allergy is an immune reaction involving the immune system, IgE, histamine, mast cells, and in the worst case scenario, anaphylaxis. But a food intolerance most of the time involves difficulty digesting the food. A food intolerance involves the digestive system, the gastrointestinal or GI tract. The two we'll look at are lactose intolerance and gluten intolerance. Now, some people talk about sensitivities, gluten sensitivity. I haven't read enough about it yet to feel that it's something I want to include in this topic, maybe next year when there's more data, but not right now. Celiac disease is associated with gluten intolerance. It's an autoimmune disease. Autoimmune means it's looking at the immune system. It's looking at something that's normally present as non-self and triggering an immune response. So this is an autoimmune disease characterized by inflammation of the small intestine. It causes diarrhea, fatty stools. When you can't digest it, it moves through your digestive tract. We'll talk about this when we get to the information in Module 3. It can make you lose weight, develop vitamin and mineral deficiencies because you can't absorb those nutrients. The treatment, eliminate gluten from the diet. Here we go. Autoimmune disease, a disease related to the destruction of the body's own cells by substances produced by the immune system that make a mistake in identifying certain components as harmful, or as I call it, a defective recognition of self. It doesn't recognize self components, and it triggers an immune response.